Hi, my name is Shanika Panton, and our group project was about the relationship between the high rates of hypertension and poor diet in African Americans. I will start with the abstract. Just a brief background. Poor diet in African Americans is suspected to be an associated cause for the high prevalence of the chronic disease hypertension. We set out to examine data to find a relationship between the two by using age, race, and gender as the control variables. The methods used was descriptive and logistic regression analysis using data collected from NHANES with the year 2015 to 2016. The results yield that there was no correlation between non-Hispanic Black individuals with hypertension and poor diet, with an odd ratio of 0.58 with a p-value of 0.01. After analyzing the data, we concluded that there was no association between poor dieting and hypertension in African Americans. Now, let's go into a more detailed explanation. Hypertension is the medical term coined for high blood pressure. It is a chronic disease that can lead to other severe health complications and increases the risk of heart disease, stroke, aneurysm, and even death. There are factors that influence the outcome of this disease. In African Americans, the prevalence of this chronic disease is at an astronomically high rate. While this chronic disease has multiple risk factors, poor dieting is suspected to be associated with the outcome being high in African Americans. So, based on this information, we hypothesized that African Americans' diet is a contributing factor in the high prevalence of hypertension.
Hello, my name is Lisbeth Reyes, and I am currently a junior majoring in public health at Georgia State University. And for our project, I'm going to introduce the methods and materials. So for the methods, this was a cross-sectional study of the relationship between the rates of hypertension and poor diet in African Americans in the United States. We used data from the NHANES website from 2015 to 2016, and we conducted a descriptive statistics and logistic regression analysis where the alpha equaled 0.05. For our materials, our outcome was the diagnosis of hypertension, and the exposure was poor diet and poor eating habits, and we controlled for age, race, and gender.
Hi, my name is Mariah Stallworth, and I will be discussing tables 1 and table 2 of our results section. Starting with table 1, descriptive characteristics, we've chosen the variables age over 30, females, males, non-Hispanic Blacks, hypertension, and poor diet. A sample size for age over 30 is 4,646 with a valid percent of 100 of all participants over the age of 30. For females, we had a sample size of 2,398 with a valid percent of 51.6. For males, we had a sample size of 2,248 with a valid percent of 48.4%. Of non-Hispanic Blacks, they had a sample size of 969 with a valid percent of 20.9. For hypertension, we had a sample size of 229 with a valid percent of 4.9. For poor diet, we had a sample size of 295 with a valid percent of 6.3. For table 2, we looked at the adjusted odds ratio for those diagnosed with hypertension. with the following variables of gender, race, non-Hispanic blacks, poor diet, and those taking prescription drugs for hypertension. We used a combination of odds ratios to relative risk to compare our data. And when found the comparisons for percentage, we found that 52.3% of non-Hispanic blacks have been told that they have high blood pressure. 94.5% of non-Hispanic blacks taking prescriptions for hypertension, and 19% of non-Hispanic blacks reported having a poor diet. I would say as our result, overall, there is no correlation that shows the percentage of poor diet that could be closely linked to hypertension in African Americans compared to other races, being that poor diet remained a constant throughout the study. For African Americans, it could be other underlying factors that are greater contributors to hypertension. And I would suggest further research that would be able to make the connection between the two.
Hi, my name is Ashley Mascata. I am currently a senior at Georgia State University, pursuing a degree in public health with an interest in global health issues. Throughout our study, we are trying to see if there are any correlations between poor diet and hypertension in non-Hispanic Black individuals. We can see that in graph 1, non-Hispanic Black individuals have the highest prevalence of blood pressure, also known as hypertension. 40.3% of non-Hispanic Black individuals over the age of 18 reported hypertension in their lifetime, with 40.6% prevalence in men and 39.9% prevalence in women. Then, by looking at graph 2, in a controlled setting, non-Hispanic Black individuals still followed high behind non-Hispanic white individuals, with the prevalence still high above 40%. The prevalence in non-Hispanic Black individuals is 44.6% in the controlled setting, with 40.1% in men and 48.5% in women. Looking at our tables and our graphs, we cannot directly correlate poor diet and hypertension in non-Hispanic Blacks because there is not enough adequate data.
Hello, I'm Ebony Tarva, a senior at Georgia State, majoring in public health. And with this poster as a discussion, hypertension being the leading cause in African Americans affects one's genetic and also environmental determinants. With this outreach program has been implemented in support of treatment to African Americans at risk, with hypertension guidelines soon to alter as combination therapy will be recommended.
Hello, my name is Cameron Sarker. I am a junior at Georgia State University, pursuing a public health degree, and I am interested in global health issues. So in conclusion, the CDC data has shown that the African American population has an association with hypertension, but our data did not. Hypertension can lead to health complications such as heart disease, stroke, aneurysm, and even death. In the results, we can see that 40.3% of non-Hispanic Black individuals have reported hypertension in their lifetime. After looking at the results, there is not enough data to conclude that there is an association between hypertension and poor diet in non-Hispanic Blacks.